Zhang organs, the liver. Key points, physiological functions of the liver, governing free flow of qi, storing blood, and the systemic relationships of the liver. The liver is related to the tendons in body constituent and shines in the nail. The liver opens into the eyes. The liver corresponds to anger in emotion. Tears are the fluids of the liver. The liver is located in the abdominal cavity, beneath the diaphragm and at the inside of the right hypochondrium. The physiological function of the liver is to govern free qi flow and store blood. The systemic relationships of the liver with the body are as follows. The liver has an interior-exterior relationship with gallbladder and is associated with the tendon in body constituent and shines at the nail, with anger in emotion, with eyes in orifice, and with tear as the fluid of the body. The liver can ensure the free movement of qi, blood, and body fluid, as well as prevent them from stagnation. The function of liver qi's governing free qi flow is mainly manifested in the following aspects. Regulating qi movement. When the liver functions normally in governing free flow of qi, the qi dynamic will be smooth. Qi, blood, and internal organs will be in a harmonious state of balance. If there is a disorder in qi flow, it will affect the functions of the liver. An under-smooth flow of qi will lead to a stagnation of the liver qi, which can result in the pathological changes of stagnation of qi. It is often manifested as distending pain and discomfort of the chest, breast, or lateral parts of the lower abdomen. On the other hand, an overly smoothing flow of qi will give rise to a hyperactivity of the liver, which will result in pathological changes of adverse rising of liver qi. It is manifested as distending pain of the head, red face and eyes, as well as irritability. Letter B, promoting circulation of blood and body fluids. Qi is the commander of blood, and blood is the mother of qi. When the liver functions normally in governing qi flow, the circulation of blood and body fluids will be smooth. If the liver dysfunctions in governing free coursing, it will lead to disorder of qi dynamic with disturbance of blood circulation. An under-smoothing flow of liver qi will lead to stagnation of liver qi and blood stasis, which manifests as mass in the abdomen with fixed shape, tumor, and amenorrhea. On the other hand, an overly smoothing flow of liver qi will give rise to hyperactivity of liver qi. It will force blood to go upward and lead to bleeding, such as hematemesis and hemoptysis. Besides, the abnormality of the liver's governing free flow of qi may lead to disturbance of body fluid metabolism, causing pathological changes of body fluids, dampness, phlegm, and fluid retention. Letter C, regulating the emotion. The liver regulates emotion by regulating the movement of qi and blood. When the liver functions normally in governing free coursing, qi dynamic will be smooth, as well as the blood circulation, and mood will be good. If the liver functions insufficiently in governing free flow of qi, emotions will be easily disturbed. The concrete performance consists of two aspects. On the one hand, if the liver functions insufficiently in governing free flow of qi, the liver qi will be congested and the mood will be easily depressed, and a little stimulation may cause refractory melancholy. On the other hand, if the liver hyperfunctions in governing free flow of qi with hyperactive rise of qi, the mood is easily to be irritable and a minor stimulation will easily cause rage. On the contrary, the abnormal emotion can also affect the liver governing free coursing, resulting in pathological changes such as liver qi depression or liver qi ascending counterflow. Thank you for your attention.
Interviewing the ears. The ears are the orifices of the kidneys, and for this reason, tinnitus and deafness are often due to a kidney deficiency. However, the ears are influenced by many other organs, including the liver, heart, lungs, and gallbladder. In addition, although the spleen is not directly related to the ears, dampness or phlegm deriving from spleen qi deficiency also may affect the ears. I generally ask about any ear symptoms under three main circumstances: when there is a kidney deficiency, liver yang rising, or phlegm. In the latter case, phlegm obstructs the orifices and may cause tinnitus or deafness. I usually ask about any ear symptoms towards the end of the consultation, primarily to confirm a pattern of kidney deficiency, liver yang rising, or phlegm. When asking about tinnitus, it is important to express the symptom in terms patients can understand. I generally ask whether they experience any ringing in the ears. It is important to let the patient understand that even an occasional ringing in the ears has clinical significance. In general terms, the ears may be affected by a deficiency pathology, usually of the kidneys, but also of the lung and heart, causing tinnitus, hardness of hearing, or deafness, or by a fullness pathology that is usually due to heat or phlegm. The main deficiency patterns affecting the ear are kidney deficiency, yin or yang, causing tinnitus and or deafness; lung qi deficiency, causing tinnitus; heart blood deficiency, causing tinnitus. The main full patterns affecting the ears are liver yang rising, causing tinnitus and deafness; liver fire, causing tinnitus and deafness; phlegm in the head, causing tinnitus; and damp heat in the gallbladder, causing earache. The ear shape is small and thin. The indication is insufficient congenital essence or kidney qi. When the ear shape has a dry helix with scales, there's blood stasis. There are sores, boils, or swelling and redness on the helix. There's wind heat or liver and gallbladder fire. There's ear discharge like earwax. The indications is normal discharge. It's yellow or white pus. There's kidney deficiency, fire with damp heat in the liver and gallbladder channels. There's blood. There's heat in the blood. The ear color and sheen. Withered and parched helix. The indication is exhaustion of kidney qi. And the five colors are white, that indicates sudden onset of wind cold or cold. When it's green-black, there's excruciating pain. There's black, it's kidney failure. Red, excess heat or damp heat. Red collateral on the back of the ear that feels cold to the practitioner's touch. It's prodrome of measles. And yellow is damp heat accumulation in kidney. Thank you for your attention.
Let's proceed to diagnosis according to 8 extraordinary vessels. Let's have the introduction. Diagnosis is based on the observation of changes in the functions or structures that are controlled by the 8 extraordinary vessels. Dumai and Renmai have their own channel points, whereas the other extraordinary vessels borrow points from other channels, and the course of these extraordinary vessels partly follows the course of more than one regular channel. This means that they can be treated locally with points that are meeting points, that is, acupuncture points, where 2 or more channels meet. Gallbladder 22 is, for example, an acupuncture point on the gallbladder channel, but it is also a point on the yang chao mai, yang wei mai, as well as an acupuncture point where the sanjiao channel meets to the gallbladder channel. This means that this acupuncture point can treat multiple channels at the same time. It's important to remember that the channels have both internal and external pathways, and that there can be branches of the channels that separate from the main channel. This means that there can be symptoms and signs in places other than along the path of the external vessel. Treatment of the extraordinary vessels. The most popular approach to activating the extraordinary vessel is to use combinations of so-called opening points. These acupuncture points, which are not usually located along the course of the extraordinary vessel, can be understood as being a key that activates the qi in the extraordinary vessel. In this approach, the opening point will either be used alone to activate acupuncture points along the channel. The opening points that most people agree upon when activating the extraordinary vessels are as follows. For the Dumai, it's SI3. For the Renmai, it's lung 7. For the Tsongmai, it's spleen 4. For the Daimai, it's gallbladder 41. For the yang chao mai, it's urinary bladder 62. For the yin chao mai, kidney 6. For the yang wei mai, it's sanjiao 5. And for the yin wei mai, it's pericardium 6. In addition to using the opening point of an extraordinary vessel, most people recommend coupling the opening point with a so-called partner point. These acupuncture points are also opening points, but for one of the other extraordinary vessel that is believed to have a relationship with the vessel that is to be activated. The most common approach is to insert the first needle of the treatment in the opening point of the extraordinary vessel that is to be activated. The next acupuncture point that is needled will then be the opening point of the partner vessel. Only after these needles have been inserted, and in this order, will the remaining needles be inserted in the other acupuncture points that are to be utilized in the treatment. At the end of the treatment, the needles will be removed again in reverse order. That is, the needle inserted in the partner vessel's opening point will be taken out as the penultimate needle to be removed and the vessel's own opening point the last. Machuche writes that the opening point should be used on the right-hand side in women and the partner opening point on the left-hand side. This will be reversed in the treatment of men with the opening point being activated on the left-hand side and the partner opening point on the right-hand side. The opening and the partner opening points are generally used bilaterally, but the first needle will be inserted on the opening point of the extraordinary vessel on the left-hand side in men and on the right-hand side in women because there is no reason not to do it in that order. Below is the most common presentation of opening point, partner opening point relations among the extraordinary vessels. We have lung 7, partner with kidney 6 for the Renmai and Yin Chao Mai. SI3 for the Dumai, partner with UB62 for the Yin Chao Mai. Spleen 4 for the Tong Mai, partner with pericardium 6 for the Yin Wei Mai. Gallbladder 41 for the Dai Mai, partner with Sanjiao 5 for the Yang Wei Mai. As was the case with the regular channels, local and distal points can be used along the pathway of the vessel to activate qi in the vessel. For example, it is possible to use Do3 and Do4 as Do-my local points and Do26 as a distal point in the treatment of lower back pain. This can be done both with or without the use of the vessel's opening and partner opening points. Thank you for your attention.
Diagnosis according to 4 levels. We discuss heat in chest and diaphragm. In addition to the symptoms and signs discussed under chi level heat, there will be signs and symptoms resulting from the accumulation of heat in the chest and diaphragm. The heat will disrupt and agitate chi in the upper jiao. This will result in a sense of turmoil in the chest. Heat will agitate the shen, resulting in irritability, restlessness, and insomnia. The heat can ascend to the throat, resulting in a sore throat. By damaging fluids, the heat can manifest with an intense thirst, dry mouth, and dry lips, as well as constipation. Etiology: exposure to exogenous pathogenic qi that is either invaded the qi level directly or penetrated down from the wei level. Symptoms and signs: persistent fever, no aversion to cold, restlessness, burning sensation and/or sensation of turmoil in the chest and diaphragm, insomnia, irritability, constipation, sore throat, dry and chapped lips, dry mouth and throat, thirst, sweats. The skin may feel hot to the touch, red face. The tongue may be dry in the central area with a yellow dry coating, rapid full pulse. The key symptoms: restlessness, pain or turmoil in the chest and diaphragm, fever, and irritability. Treatment principle: drain heat from the upper jiao. Acupuncture points to choose from are 214, Sanjiao 6, Sanjiao 5, LI11, Ren 15, Ren 17, UB16, UB17, pericardium 6 and pericardium 8. Needle technique is draining. Do 14, SJ6 and SJ5 and NI11 drain the heat. REN 15, REN 17, UB 16 and 17 drain heat from the chest and diaphragm. Pericardium 6 and pericardium 8 drain heat from the pericardium. The person should avoid consuming food and beverages that will create additional heat in the body. Heat in the chest and diaphragm can be caused by Hui level heat, and heat in the chest and diaphragm can result in yin level heat, blood level heat, and heart fire. Thank you very much for listening.
Let's talk about combining points principles, balancing yin and yang. Balancing the yin and yang character of the point used is also important. The nature of the acupuncture points give us a great choice in the use of points, and we should not think that in order to treat a yin organ, a yin channel should be used, as it is possible to use a yang channel to treat a yin organ, or vice versa. For example, stomach 36 tonifies the spleen. This makes it possible to have a wide choice in the balancing of yin and yang points. Generally speaking, it is better to balance yin and yang points with one treatment. The excessive use of yang points may make a person slightly uneasy or edgy, while the excessive use of yin points may make a person tired. Especially when several points of one polarity are used, it is a good idea to balance them with one or more points of the opposite polarity. To use the same example as above, if one is treating a shoulder problem with several points on the large intestine channel, it would be good to balance them with a single yin point, such as the liver 3. This balancing technique could be combined with balancing of left and right and top and bottom. Thus, one might use Li15, Li11, and Li4 on the left side and liver 3 on the right. That is balancing yin and yang, left and right, and top and bottom, as seen on this slide. Of course, balancing points should not be chosen just for the sake of balance, but preferably according to a presenting pattern. In other words, it is always better if there's more than one reason for using a certain point. In balancing yin and yang, it is particularly advisable to pay attention to balancing yang channels with the yin channel of the yin organ across the overacting cycle of the 5 elements. As follows: the gallbladder and the spleen, small intestine and the lungs, stomach, the kidneys, large intestine and the liver, the bladder, and the heart. The example of balancing a series of points on the large intestine channels with a point on the liver channel has been given above. Another example of the balancing of points of yang channels with points of yin channels across the overacting sequence might be the use of spleen 6 or spleen 3 to balance a series of points on the gallbladder channel, such as gallbladder 30, gallbladder 31, and gallbladder 34, treating a sciatica, for example. Thank you for your attention.
Let's discuss diagnosis according to Zhang Fu organ patterns with the pattern pathology of spleen imbalances. If the spleen is not able to transform food and fluids that are ingested adequately, the pure qi will not be separated from the impure dregs. This will result in pure qi being conveyed downwards along with the impure residue. This means that the person will lack qi and they will therefore feel tired and fatigued. When there is only a partial transformation of the consumed substances, dampness will arise. This is because some of the impure residue that should have been separated from the pure qi will be sent upwards along with the pure qi instead of being sent downwards to the small intestine. This can often be seen on the tongue, which develops a greasy or sticky coating. Dampness can result in fatigue because the spleen is overburdened and thereby produces less qi, and because dampness will inhibit the movement of qi in the body. When there is dampness, the fatigue will often be most pronounced in the morning and after consuming damp-producing foods. If there is spleen qi deficiency, the fatigue becomes more pronounced as the day goes on. Both dampness and spleen qi deficiency can manifest with fatigue and sleepiness after meals. This is because the spleen qi that is available is used to transform the food, and because the dampness that arises as a result of the inadequate transformation or was already present will block the pure yang qi from ascending up to the head. Furthermore, damp phlegm can settle like a fog and block the shen. If the transformation of the food has been incomplete, or if there is dampness, the stool can be loose and formless. If there is spleen yang deficiency, or if there has been an invasion of exogenous damp cold that extinguishes the spleen's physiological fire, the transformation of the ingested food and liquids will be so limited that the stools are watery and contain undigested food. If there is damp heat, the heat can cause the stool to become sticky and odorous. There may well be a stinging or burning sensation in the rectum. The heat can be so intense that it agitates blood so much that it bursts the walls of the vessels, resulting in blood in the stool. Blood in the stool can also be seen when there is spleen chi deficiency because one of the spleen's tasks is to hold blood inside the vessels. If there is spleen chi deficiency, there can be bleeding in the intestines, and in fact, all forms of bleeding can be the result of spleen chi deficiency. It's typical, for example, that mid-cycle and it is typical, for example, that mid-cycle spotting and prolonged or heavy menstrual bleeding in women can be a manifestation of spleen chi deficiency. Furthermore, the inability to hold the blood inside the vessels can mean that spleen chi deficiency manifests with easy bruising. Spleen chi not only holds blood inside the vessels, it also lifts and holds organs in place. Thus, when there is spleen chi deficiency, in particularly spleen yang deficiency, it can manifest with organ prolapse, hernias, hemorrhoids, and a sensation of heaviness or that everything is dragging downwards in the body. If there is a reduction in the production of wu qi, it will not only result in fatigue, but it can also lead to blood deficiency because blood is created from wu qi. Furthermore, a poor production of qi and blood can cause the muscles, especially in the arms and legs, to feel weak or feeble because the muscle lacks nourishment. Dampness can manifest with a sensation of heaviness in the arms and legs. The limbs feel heavy because dampness is a yin pathogen that, and because it inhibits the movement of qi. Damp heat, on the other hand, can make the muscles feel painful. If there is yin yang deficiency, the arms and legs can feel cold because when there is yang deficiency, there is not enough physiological heat in the body to warm the limbs. This lack of physiological heat is why the stool can be watery and contain undigested food. Watery stools and coldness of the limbs are key signs when differentiating spleen yang deficiency in relation to spleen qi deficiency. When the spleen and stomach do not send their qi upwards and downwards respectively, it will stagnate in the middle jiao. This will manifest as abdominal bloating and distension. The distension and bloating will be most apparent after the ingestion of food. The qi stagnation in and around the stomach and spleen can often manifest with a reduction in the appetite or nausea. Poor appetite is actually an interesting sign. The Chinese textbooks, poor appetite is a key sign when diagnosing spleen qi deficiency. Nevertheless, the majority of clients who are spleen qi deficient report that they have a healthy appetite. There can be several reasons why they respond in this way. First, there are several mechanisms that result in a person wanting or needing to eat, as well as ingesting food being a fundamental necessity in order to provide nourishment to the body. Eating is a form of pleasure, a way of comforting the psyche and something to do when you are bored. Consequently, one or more of these mechanisms can result in a desire to put food into the mouth, even if the stomach does not feel particularly hungry. Furthermore, many people with spleen chi deficiency also have heat in the stomach. This means that they have an increased appetite. A useful question to ask patients is whether they have an appetite in the morning. Many people who are spleen qi deficient have no appetite in the morning and often skip breakfast. This is because the spleen and stomach are too weak to send their qi up and down, and the circulation of qi in and around the middle jiao will only start functioning when there has been sufficient physical activity to activate it. This is even worse if there is damp. Dampness tends to stagnate in and around the stomach and spleen when the person has been lying still all night, and this will block the already weakened movement of qi. Thank you for your attention.
Diagnosis according to Shi, Shui, Jinye imbalances. Blood loss. Blood loss. This differentiation includes all forms of abnormal bleeding, whether it is from the nose, the gastrointestinal system, the urinary system, the respiratory system, or menorrhea. There are three main causes of bleeding. The walls of vessels are not strong enough to keep blood within the vessels. Spleen qi shu. Blood is agitated and frenetic in its movement, so it ruptures the wall of the vessels, shi or shu heat. There is a blockage on the vessel, which results in a buildup of pressure in the vessel, which finally bursts, blood stagnation. Often, there will actually be a combination of two or more of these factors at the same time. There will be a difference in the quality, color, and amount of the blood that is lost depending on the cause. Bleeding usually leads to shui chu, and if the bleeding is internal, it will create blood stagnation in the local area. When there's blood loss, it is important not only treat the underlying pattern of imbalance that has led to the bleeding, but also to invigorate blood. This is because the bleeding will have created a local condition of blood stagnation. Furthermore, it is important to subsequently nourish blood in order to replenish the blood that has been lost. Symptoms and signs: bleeding and blood loss. When there is qi shu bleeding and blood loss, the blood will be paler and more watery. There will be pale tongue and there will be a weak pulse. When there is a shi heat bleeding and blood loss, the blood will be fresh and red or bright red and possibly sticky. Heavy blood loss, red tongue, rapid and full pulse. When there is a shui heat bleeding, there will be bleeding and blood loss. The blood will be a fresh red color, low volume blood loss, red tongue without coating, and rapid and fine pulse. When there is blood stagnation bleeding and blood loss, the blood will be dark and probably clotted. There will be a low volume of blood loss. Blood will be dark purple and swollen sublingual veins. There will be choppy or confined pulse. The key symptoms of blood loss, the treatment principle is stop the bleeding. The acupuncture points to choose from are spleen 1, spleen 8, spleen 10, urinary bladder 17, liver 1, and kidney 8, as well as points relevant to the underlying pattern of imbalance. Needle technique, even technique. Moxa should be used on spleen 1 and liver 1. The explanation is spleen 1 and liver 1 are points that empirically can stop bleeding. Spleen 10 and urinary bladder 17 stop bleeding and invigorate blood. Spleen 8 and kidney 8 stop bleeding from the uterus. Relevant advice. This will depend on the underlying pattern of imbalance. Please see the relevant section for specific advice. It is important that a person who has suffered from bleeding make sure that they eat a diet that nourishes blood. Example, red meat, chicken, liver, green leafy vegetables, beetroot, seaweed, dates, nettles, aduki beans, kidney beans, and black beans. They should also eat a diet that tonifies spleen qi. Blood loss can be caused by the following patterns of imbalances: spleen qi shu, yin shu heat, shi heat, and blood stagnation. Blood loss can result in the following patterns of imbalance: shui shu, shui stagnation, yin shu, jin yi shu, qi shu. Thank you for your attention.
Let's talk about etiology and pathology of diarrhea. The term diarrhea is defined as the passage of semi-formed or watery stools that are usually, but not always, passed more frequently than normal. In Chinese, the word diarrhea is composed of two characters, both of which have the sound she, one meaning loose stools, the other stools like water. Acute seasonal diarrhea is more frequent during summer and autumn. Invasion of external pathogenic factors. External pathogenic factors causing diarrhea can be cold, dampness, and summer heat. Cold can invade the intestines directly bypassing the body's defensive qi portion. This happens when one is exposed to cold weather. Contrary to what one might expect, it happens more frequently in summertime when one is lightly dressed. If there is a spell of unreasonably cold weather, or if one stands in the wind. After swimming with the body still wet, then cold may invade the intestines and cause diarrhea and abdominal pain. The simple questions in chapter 39 says, when cold invades the small intestine, this cannot transform food properly, and diarrhea and abdominal pain result. The spiritual axis in chapter 29 says, when cold invades the stomach, there is abdominal pain and distension. When it invades the intestines, diarrhea and borborygmi result. When the stomach has cold but the intestines heat, then distension and diarrhea result. Summer heat also invades intestines and spleen and is a frequent cause of acute diarrhea in summertime. In this case, the person will also have symptoms of invasion of the defensive qi system by summer heat, that is, fever and aversion to cold. The simple questions in chapter 5 says, when wind injures the body in springtime, diarrhea results in summertime. Of the external pathogenic factors, dampness is the one that most frequently causes diarrhea. External dampness penetrates the channels of the leg and flows up to the spleen, where it obstructs its function of transformation and transportation, leading to diarrhea. Diet is, of course, a frequent cause of acute or chronic diarrhea. The most common cause of acute diarrhea is eating spoiled food, too hot or too cold foods. Chronic diarrhea may be caused simply by overeating or by the excessive consumption of cold, greasy, or sweet foods. This impairs the transforming and transporting of the spleen so that spleen qi cannot ascend and diarrhea results. Zhang Chepin says in the complete book of Qingyue, diarrhea is either due to diet or invasion of a pathogenic factor. When due to diet, there is cold accumulation. Worry, pensiveness, brooding, and excessive mental work weaken the spleen and may cause chronic diarrhea. Anger, which normally affects the liver, may also affect the spleen when one gets angry or frustrated after meals. This upsets the spleen's transforming and transporting and leads to diarrhea. Zhang Chepin says in the complete book of Qingyue, if anger occurs during or after eating, it injures stomach and spleen. It affects both liver and spleen, and wood invades earth. Working long hours associated with irregular eating or physical overwork, including excessive exercise, weakens the spleen and often leads to diarrhea. Any chronic illness also inevitably weakens the spleen and may lead to diarrhea. Working long hours without adequate rest under conditions of stress may weaken the kidneys. If a person has a tendency to yang deficiency, it will lead to kidney yang deficiency. When kidney yang fails to nourish spleen yang, the spleen lacks the warmth necessary to transform and transport, and this may result in diarrhea. Zhang Chepin in the complete book of Qingyue says, the kidneys are the gate of the stomach, and they control the two lower orifices. Thus, the opening and closing of the two lower orifices depends on the kidneys. If kidney yang is deficient and the fire of the gate of vitality is declining, yin qi is victorious and diarrhea results. Thus, diarrhea is most of all related to the spleen among the internal organs, and of the pathogenic factors, it is most of all related to dampness. Of the internal organs, the liver and kidneys also play a role. For this reason, Zhang Chepin says in the complete book of Qingyue, the root of diarrhea cannot not be in the spleen and stomach. In any type of diarrhea, there is always an inversion in the movement of spleen qi. That is, spleen qi descending instead of ascending. The simple questions in chapter 5 says, when clear qi descends and turbid qi ascends, there is diarrhea. Thank you for your attention.